I'm Dr. Amanda Kennedy, a veterinarian at Cats Only Veterinary Clinic.
I am Ashley Sapphire. I'm also one of the veterinarians here at Cats Only. When Deckham arrived, he was in, it was pretty apparent that he was in respiratory distress, and he was breathing very shallow and he was breathing very rapidly. So once we determined that it was the lower airways or his lungs that was the problem, we went ahead and got some x-rays, and that confirmed that he did have a diaphragmatic hernia. So at that point then we wanted to get a blood pressure on him, get some of his vital information, find out what how he was systemically, how stable he was. We collected a blood sample, and that's where Dr. Kennedy was saying that you have to be very, very careful when you're taking blood samples from cats in respiratory distress. Even the slightest bit of restraint can sometimes put them over the edge. And so, luckily our staff here is really well trained in how to restrain and safely and gently collect a blood sample. So we were able to get some lab work on him that showed he was otherwise a healthy cat, and he would be a good candidate for surgery. So then we did do a brief abdominal ultrasound just to confirm and kind of try to get a better idea of exactly what organs were missing from his abdomen and which ones were in his chest, and able to kind of get a plan for how the surgery was going to go down.
So once we had Deckham in surgery, we had a nurse that was his anesthetist monitoring all of his vitals, his ECG, his blood pressure, his temperature, his pulse, his respiratory rate. And then as soon as we entered the abdomen, we had another nurse be kind of his ventilator, because we lost that negative pressure that his lungs need to expand and inflate. So it was her job to breathe for him for the entire surgery, basically.
Until we got the diaphragmatic hernia resolved, repaired.
Yeah.
So luckily, Deckham, his owner, brought him here to Cats Only when she recognized a problem with him, and because of our skilled nursing team and our doctors and assistant staff here, we were able to treat him. We did all our diagnostics here in-house, so we were able to really take care of everything from beginning to end for him, and he was able to go home, and he's now living a good, happy, healthy life the way he should.